Welcome to the Prospective Doctor podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. I'm very excited to have our special guest today, Dr. Blair Nelson. I'm just going to give him an opportunity to tell us a little bit about himself.
Thank you very much. It's nice to meet you. A little bit about me. Well, I grew up in North Dakota. Not many people in that state, so I'm probably one of the few people you will meet from that state. I spent the first 22 years of my life there, attended University of North Dakota for my undergraduate work, and then went on to do my medical school at University of Minnesota in Minneapolis. And then from there, went on to do my residency training at the Mayo Clinic. And for the past 20 years, have worked in emergency medicine.
That's awesome. So, as you said, you actually, I think, are the first person that I've met from North Dakota. But aside from that, you are an emergency room physician. What made you choose the field?
It's a great question. It wasn't an easy choice or something that came to me early on. It was kind of an evolution over time. I began medical school. I thought my focus was going to be orthopedic surgery. I was an athlete. I had undergone some orthopedic procedures myself. So I was something we termed back in the day called a gunner in medical school. I'm not sure if they still use that term 25 years later, which meant I was very focused on getting good grades, which you know very well. And I did 4 years of research in soft tissue sarcomas to gain the right experiences to get a residency position in that particular field. Well, when I did my fourth year sub-internship in orthopedic surgery, I realized I am way too attention deficit, be in the operating room all day, and really didn't like how narrow the focus became as you got further into your career with that, and didn't want to give up a lot of knowledge that I'd worked so hard to obtain all those years. So then it became a bit of an identity crisis then, because I'd been so focused on that for so long that I floundered around for a while. And as I did more clinical rotations and talked to my peers and my family about what they felt were my best characteristics, my best skills. And after, getting feedback from people was so important in this process. And I found that I have a unique skill in the fact that I can make people feel pretty comfortable and connect with them pretty quickly. Mm-hmm. So that's an important trait as an emergency department physician, in my opinion, is to gain this rapport with somebody you've never met before, gain their confidence and in a very short period of time. And also I enjoyed the aspect of it that you are able to make a big difference in people's lives when they're at sometimes their most vulnerable, their most distressed. And I really enjoy comforting people in those times of severe stress, anxiety, and pain.
I love that you brought up the fact that when you went into medical school, you were a little eagle-eyed and super focused on what you thought that you would like to do. And then you had kind of an epiphany. It was like, this is awesome. It's super cool, but it's not something that I want to do for the next 30 years. And I think that a lot of students enter school thinking of that. And that's why I try to stress that it's very important to kind of immerse yourself into each rotation, because you'd be very surprised. You might like something, or you may have your rotations at the end of your time, and then you get there and you're like, what else can I do? So it's really important to do something like that.
It is. It's very important. And I love orthopedics. Mm-hmm. I love orthopedic medicine. I just had to be really honest with myself of what do I see myself enjoying the most for the longest period of time. So you're absolutely right. Staying open to each experience is so important.
Absolutely. And then also not pushing through. Like you said, you did like orthopedic medicine and you had done all the research in it, and you, I'm sure, had gotten acquainted with a lot of the faculty and residents and students. And when you get there, sometimes students try to push through and do it. And that's a lot of times where you may match into orthopedics like you were originally attempting to do. And then 3-5 years later, or during residency, or when you're an attending, you're like, I want something else. And that's a lot of times when the students will either switch residencies or decide that they want to leave medicine looking for something else. So if you do have those inklings or those feelings, it's okay to explore something else. Don't just be like, oh, everyone thought that I would enter orthopedics, I must do it, because it's a lifetime commitment. So
it is a lifetime commitment. And it's possible to change gears in residency or in your career, but it's a much more difficult road to changing at that point. So it is a little bit easier if you can kind of make that life decision during your time in medical school.
Absolutely. So you are a med school coach, mentor, our sponsors. For everyone out there, check out our website, click subscribe, all of the fun things. What type of student do you think makes an excellent medical school candidate? You mentioned a few things in terms of what makes a great emergency physician, as in having that great patient rapport, being able to switch from case to case quickly, and all of those types of things. But what do you think makes a great medical school candidate?
Great question. Yes, I do work as a physician advisor for Med School Coach, and have loved working with these company, and have been here almost a year now with them. And I've been doing this kind of work throughout my entire career. I'm the director of our medical education department, so I coordinate all the medical student rotations. And I also have mentored friends, family into medical school. So it's kind of a natural transition to start working with this company. So what makes the best medical school candidate is someone who is comfortable juggling multiple responsibilities at once. Intelligence is part of it, absolutely. But sometimes even the people that are what I would quote super intelligent, echelons above my intelligence level, sometimes will struggle in the world of medicine because of the distractibility of this profession. You get pulled in so many directions throughout the day and have to be able to juggle multiple responsibilities and keep all those juggling balls up in the air at the same time. Also, someone that's comfortable working in the area of non-absolute. So I would consider myself a scientist per se. I don't do bench research at this point in my career. I have done research, but my background in medicine is a science field. But medicine is not black and white. It is definitely an area of grays as far as science is concerned. So some people that really excel at, let's say, math or physics, medicine might not be the best field for you, because there are not a lot of answers that are absolute. It's a lot of educated guesswork.
Absolutely. I couldn't agree more, because it's kind of an experience where people are looking for, this is the data, how do I fix it? Yes. And of course, most of us were drawn to science because a lot of us have a background in like being a biology major, chemistry major, or something like that. But there is that other component where, number one, the bodies never read the textbook. So of course, we're going to learn all this information and try to go through thinking through a process and get to some kind of consensus on something that most doctors would do in terms of guidelines and treatments. But sometimes there are things outside of the edges, those what they call zebras. And outside of that, there's also that other component that you brought up about humanity and kind of bringing in that rapport and connecting with people and talking people through things. I know for the students out there, we are having a lot of discussions on this, especially during the pandemic, where there's people who have been adamant against getting like their COVID vaccine or something like that. But when they talk with their physician, sometimes minds are able to be changed and things like that. So it's not just like, okay, clear, cut and dry, you need it, get it next. You have to have that rapport and that kind of relationship building.
Exactly.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of pre-meds who apply to medical school don't even get accepted. And if you want to get accepted into a top medical school, It's even harder. It's a complicated process, and even students with great grades and MCAT scores get left out. That's why more students than ever are turning to Med School Coach for admissions advising. Our advisors are all physicians and former admissions committee members, so they know exactly what medical schools are looking for. One-on-one admissions advising from Med School Coach makes all the difference. Our expert team will help you develop a game plan, prepare your application, edit your essays, and coach you for interviews. Every pre-med has a story, and we'll help you tell it so you can stand out from the crowd. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach admissions advising package. You can achieve your medical school dreams, and Med School Coach can help.
And, I graduated medical school in 1998. And so after a few years of working in your field, the medicine part of it actually gets very easy. Mm-hmm. I know it's very challenging when you're in med school and you're training, and even the first year or so out of residency, just performing the medicine part of it is still extremely challenging because it is such a difficult set of knowledge to apply. Once you get past that point in your career, though, where the challenge continues for the remainder of your career is working with the humanity portion, like you brought up, mm-hmm. social portion of it. Every single person that presents with their medical issue comes along with it with their social issue.
Absolutely.
And that's where every single treatment plan isn't just based on the medical pieces of the puzzle. It's also based on the social and psychological and all kinds of cultural competence background issues that come into play that will ultimately finalize your treatment plan for that individual patient.
I couldn't agree more. And I know that it's a very hot topic about like the social determinants of health and all of those things. And it's true, like certain patients, what they're living with in their life experiences definitely can affect their prognosis in ways that their condition is treated. For example, I'm a family physician, and typically if someone had high blood pressure or hypertension, you come up with a plan, you give them medication, you follow their labs. Hopefully they get better if they are quote unquote compliant. But I'm sure that as an emergency physician, you see a lot of patients coming in with poorly controlled hypertension. And when you ask those questions, you could just brush it off and say, oh, they're not compliant. But if they can't afford the medication, or their doctor's office is full, or they have to choose to go to work instead of going and staying on top of their things, or can't afford certain foods to help them kind of stay within the right zones, there may be issues and they may end up in the emergency room. So it's not as clear cut and dry as, okay, they need hypertension, give them this medicine, they'll get better. So we definitely have to think about all of those factors.
You're absolutely right. And I think that comes back to the art of medicine, mm-hmm. where you take all of those factors into account and not just the science factors. And I would like to give you some accolades as a family physician, because I think that's one of the most challenging specialties out there. And I don't think it's enough credit these days. I spend minutes with patients, a half hour at the most, and you spend a lifetime with your patients. And that's where you really can get into those deeper layers of that challenge. And that's where the true art of medicine is in with the family medicine and primary care folks.
Thank you.
Work with these families through so many difficult and medical, social, psychological challenges. Thank you for what you do.
Thank you. So, talking about patient care, what would you say, and this may be hard to choose, what is your most memorable patient moment?
Yeah, when you're 20 some years into your career, you gather a bigger and bigger basket of these. I have worked in several different types of emergency departments in my career. And I worked for several years in an emergency department in a resort town in Minnesota. There's a lot of lake activity. And there was a child age 4 that was a cold water drowning.
Oh.
And was under the water for 35 to 40 minutes and was brought in asystole and was able to revive that child.
Wow.
Had worked there for several years, so saw the progression of the child, and the child was severely neurologically impaired from that, to the point that required full-time care. and came in with a pneumonia a year or two after that to the ER. So I was able to see the family, and I'm going to try this without choking up, but I had one of those rare moments where I didn't know what to say to the family. And I looked at the mom and dad and I said, I'm not sure I did the right thing when I brought your child back. And they both came up and embraced me and said, we are so grateful just to be able to hold our as of you. So that sticks out in my mind, because sometimes we do things in medicine where we're not sure if we in the whole scheme of things did the greater good or what's right, the benevolence of it. But the closure I got on that case with that family was absolutely incredible, and I'll never forget that.
That's an amazing story. I will be honest, I wasn't expecting such a powerful moment. And there are so many powerful moments as you get through the years in medicine that it's hard to choose. And when you brought up the story of the child and their experience and then their deficit from there, like, it just makes me very thankful that there are physicians out there like you mentioned about all of the relationship building and things that happen in family medicine, but you do see a lot of repeat patients in emergency medicine. And it was wonderful that you were able to see that family and for them to share their gratitude. And even though the child's quality of life may not have been what it may have been if that event didn't happen, they were so thankful, and hopefully the child will have some quality of life, and you were able to contribute to that. So that's awesome.
Thank you. Yeah. And I apologize for the little bit emotional.
I love it. I love the realness. And I will be honest, I think that we need more of that on this show, especially since we have listeners who are in the early phases in pre-med and then in med school, because we see a lot of cases. I was talking with a guest recently where we talk about all of the wins. And this was a win. I will say this is a win.
Right.
But we don't talk about the struggle or a lot of the end of life care, because that is a part of medicine. And it's the part that a lot of physicians deal with daily, in having to go from, I'm sure my experiences aren't as intense as yours, where you can go from one room where you're excited because someone's been trying to have a baby and they finally got pregnant, to the next room someone has a terminal cancer and you have to tell them the diagnosis. But you go from room where someone might come in for a urinary tract infection, and then the next room you're coding someone and they may not make it. So these are things that we carry with us and we take with us, and we need to have open discussions about all of the variety of medicine.
Exactly. Very good point. And that brings up a natural kind of next topic of, because whether you're a family physician or orthopedist or an ER doctor, these are real powerful psychologically weighing cases where you have to have a outlet to self-care as a physician.
Absolutely. Self-care is very important.
Because it can cause very incredible burnout and other issues if you don't take care of yourself, your psychological and physical well-being during all of these challenging emotionally times.
Absolutely. And that actually brings me to my next question. Since you mentioned self-care, during college, you worked as a radio disc jockey. What makes medicine a better choice? And then my follow-up question to that is, do you still DJ sometimes?
I do, actually.
That's awesome.
That's a funny story. So medicine, a better choice? It depends on how you look at it. I loved working as a radio disc jockey. I absolutely loved it. I did it for 5 years. Started it when I was in college. It was for not a college radio station, but a terrestrial radio station in the market. Actually did pretty well and was being offered a lot of jobs right before I matriculated into medical school in bigger markets. So it was kind of a last minute, should I or shouldn't I? I'm so glad I chose medicine, because it's opportunity to do other things that I didn't get a chance to do in radio. But I'm also grateful for my time in radio because that was such a polar opposite occupation. Where I do still DJ is my children are in their late teen years, and I still have connections in the radio world. And I was asked to DJ their proms.
Wow.
Yeah,
That's
so
awesome.
I got the equipment from the radio station that I was affiliated with and played music for my children's prom. So
How did your kids take that? Were they excited that you were going to be DJing their prom, or were they like, ah?
they're the ones who wanted it. I had no interest in doing it. Yeah, it's been a while, since I'd done anything like that. But they really wanted their dad to be there and be a part of it. So that was why I did it, was because of their, wanting me to.
That's so amazing.
At Med School Coach, we know that studying for the MCAT exam can be challenging, especially for busy students on the go. That's why our team created MCAT Prep, the only all-encompassing study app built specifically for the MCAT. MCAT Prep by Med School Coach provides student access to extremely high-quality content and a personalized curriculum for free. The app has more than 250 videos, 1,000 flashcards, and 1,000 unique MCAT questions. Plus, MCAT Prep by Med School Coach allows students to create a personalized study schedule and track progress over time. You need every competitive advantage you can get to get into medical school, and now you can put the experts from Med School Coach into your pocket. It's the closest pre-med students can come to a personal tutor without spending a penny. Download MCAT Prep by Med School Coach for free at medschoolcoach.com/MCAT. Or download it directly from the Apple Store or Google Play Store. You can achieve your medical school dreams, and MCAT Prep by Med School Coach can help.
I do have one quick funny story on that if you have a moment.
Yes.
So I remember vividly being in college, and I was pre-med, so I had some kind of difficult classes and tough schedule, and I was a morning radio disc jockey at that point, so I worked from 5:30 in the morning till 9:30 in the morning, and then I class right afterwards. I didn't use my real name, like most people in the entertainment world. And I would get to the classes, and I could hear people around me talking. Did you hear what those bleeps person said on the And I'm just kind of ducking my head down, going, "No, I didn't hear him. What was it? What did they say?"
But you were like Batman or something. Your secret identity. Did they ever find out?
Oh, yeah, eventually it came out, yes.
That's so funny. You're like, no, I don't even listen to that station. That's super funny. Well, this was such a fun episode. My final question for you is, as you know, we have a lot of pre-meds and med students listening to the show. What is one piece of advice that you would leave for them?
There is no person in this world of medicine that has had a linear trajectory from college, to an attending physician. There are detours, unexpected setbacks that make everyone's journey throughout college, med school, residency nonlinear. So if you experience a setback or don't get in, let's say, your first application cycle, and this is truly what you want to do, just wipe yourself off and keep moving forward, because you'll get there.
I couldn't have said it better. Like, the reason that we call it a journey through medicine is because it's a journey. Like, we don't know what's going to happen. And if it's supposed to be, it's going to be. And just keep trekking. If you have hiccups along the way, definitely reach out to your mentors or your colleagues. You can also reach out to Med School Coach. You can message us on our website. We have an Instagram at Med School Coach. You can reach out to my Instagram at Dr. spelled out DOCTORD, the letter Graham, GRAM, and let us know if you have any suggestions about what types of shows or what you want to hear about. You can let us know that, and then we might even ask you to come back and DJ for us for an episode. The prompts can't only get it.
I'll dust off the cobwebs once again. Yes.
Might have to have like a med student playlist or something. We'll
yeah, exactly.
Are there anything else that you would like to leave our audience? Just feel free to say it before you say bye.
I just am just honored to be a part of the show. Thank you so much.
Thank you so much. And for all the listeners out there, I'll be back next week with another guest. Have a great week.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.